Conus is really I think it's a very underutilized restoration with such tremendous advantages. One of the biggest problems that we have today in implant dentistry, especially for the full arch restorations, is peri-implantitis, peri-implant mucositis. And one of the reasons is because of, especially in the upper arch, we want to try to get the aesthetics at the detriment of the tissue. So we have to close things up. So while it may look good for a while, we're making it impossible for the patient to keep it clean. But yet patients want to have something permanent. The advantage of Conus is that we now have the ability for a full arch type of restoration that the patients do have that feel of permanency because of the retention is so great with the frictional retention, but yet whenever they want, they can remove it and clean around the implants. And what we've seen in using Conus through the years, and a predecessor of Sincone before that, is that the actual health of the tissue has really not changed from the time that the implants are placed or that when we first have done the reconstruction many, many years ago. And I have some patients that go back 12, 14 years that the tissue just looks excellent that I know we could not get with any sort of screw-retained restoration. So that to me is the advantage of the Conus. The Lucitone digital print has really enabled us to do this type of restoration a lot faster with the digital type of approach. We have taken something that we have gone from 5 or 6 appointments to now 2 appointments. From start to finish, 2 appointments. Now think about that, because the conventional approach to Conus to do it properly involved a lot of steps, pickup impressions, and everything else, a lot of room for error. Now we can get it in 2 appointments, maybe at the most 3 appointments if we want to do some sort of try-in. But on the majority of our cases, because the patient has had an immediate denture that they've been happy with all the months, we have been able to do most of our cases in 2 appointments. It's predictable, it's aesthetic, it's strong, it's what we're using in our practice all the time now. We have now something that is archivable, that if the patient loses anything, we can have another, and one of our patients did, we could have another denture made for them within a couple of days, with the exact same aesthetics, the exact same teeth, the exact same everything. There's no sweat. We can do it without any sort of impression, without any sort of uncomfortable feeling for the patient to be walking around or coming into our office where we have to do some impressions. If they call us up and say something's happened to the denture, I've lost it or whatever, we can have something for them and just re-pick up the Sincone caps on the Conus abutments. It is truly a remarkable system now.